Good morning, good afternoon, good evening, everyone. Thank you for joining us for this webinar on outcomes-based financing. My name is Judd Staples. I am Assistant Director of Partnerships and Innovator Engagement for the Duke Global Health Innovation Center and Innovations in Healthcare. This is the second panel discussion in our Inclusive Healthcare Talk series, sponsored by Bayer Foundation. Today, our panel will explore how mission-based investors, funders, and ventures can collaborate to construct financing that meets the needs of the entrepreneurs to scale and serve their customers in a financially sustainable way, while assuring capital providers that their funding is having measurable impact. Today, we'll be asking what are some successful models, what are the challenges in implementation, how can the models and the ecosystem be adapted to facilitate increased investment and venture participation. Please keep your microphones muted and your cameras off. We'll feel free to introduce yourself in the chat function. There's also a separate question and answer section. Please put your questions in there. We're going to have several minutes at the end of the panel to answer questions, and we'd also love to hear from you, your stories of outcomes-based financing and struggles and challenges and successes in that area. We'd love to have your participation. So with that, I'd love to go ahead and get started. I'd love to ask our panelists to introduce themselves. We'll just go in the order there on the introduction slide. Nicole, if you could start us off, tell us a little bit about yourself and a little bit about Instiglio and what it is that they do.
Thank you so much and welcome everyone. Really excited to be part of this panel today. My name is Nicole Pflock. I'm an associate partner at Instiglio. And Instiglio works with governments, funders, as well as implementers, entrepreneurs, to improve the effectiveness of spending and the effectiveness of programs. And we do this not exclusively, but mainly by helping partners to structure outcomes-based financing models, as well as implementing data-driven performance management systems that get them to greater impact. So excited to joining today. And over to Marissa.
Thank you. So happy to be here. Thanks everyone for joining. I'm Marissa Leffler. I'm the Health Program Director for the UBS Optimus Foundation. UBS Optimus Foundation is a grant-making foundation established by UBS, the global wealth management firm. We're not an endowed foundation or a corporate social responsibility initiative. The foundation was established as a service to offer UBS clients and employees to achieve more and better outcomes with their philanthropy through programmatic support and innovative financial mechanisms. So all costs of the foundation are covered by UBS. So 100% of our clients' resources go towards driving systemic change at scale to address some of the world's most intractable social problems, so including health as well as education, child protection, and climate change in the environment around the globe. We acknowledge that every social problem may need a different solution, and therefore we provide flexible capital across what we call the impact spectrum, including grants, direct investments in social enterprises, and outcomes-based funding instruments like the ones that we're going to talk about today. So very happy to be here, and I'll turn over to Daphne now.
Thanks, Marissa. Good morning, afternoon, everybody. My name is Daphne. I'm the CEO of Access Afya. We're a social health enterprise based in Kenya. We have developed a model for primary healthcare, for localized primary healthcare, and a model to distribute this through franchising, particularly to meet the needs of low-income markets. And I'll be talking a little bit more about our experience in blended financing and more specifically in outcomes-based financing, and really looking forward to this conversation. Thank you.
Thank you, Nicole, Marissa, and Daphne. looking forward to this conversation. So I'm going to start off with you, Daphne. Please give a brief history of Access Afya. How has it historically financed its mission, and outline the most recent financing round? How is it structured? What attracted you to that structure, and what are the advantages and disadvantages from what you saw?
Thanks, Jen. So just a quick background then for Access Afya. We're founded in 2012. We're based in Kenya. And what we have aimed to do is how we have approached our solution is to redesign from the ground up a comprehensive outcomes-focused primary care model for the needs of the mass market. And so we saw a need to combine high-touch and low-touch interventions, tech and data, digital diagnostics, friendly patient care, supply chains to deliver this care. And so today, patients can access at one-stop shops, micro clinics, consultations, diagnostic tests, and medications at an average price point of $3 a visit. And so today we're distributing quality and affordable care through a franchising model. So we work with local healthcare workers to replicate this impact in their communities. So the challenge, lies in social enterprise, and with like many people on this call as well, is in creating these microeconomic models, but we're operating in macro with macro costs and macro factors. This is healthcare. It requires a high degree of technical inputs, a diverse skills teams and needs to enable us to attract and retain these teams. We're headquartered in Nairobi, and so we have some of these macro factors, and we're really driving down the cost and affordability of care. So we're working with a low margin, massive scale model. So in pursuit of sustainability as a for-profit business in the direction that we're building, this creates tensions inevitably to generate more revenue. Sometimes this can mean deprioritization of less profitable services and creates ultimately the risk of mission drift. And so we've kind of remained squarely in the low income market. So over 90% of people that we serve today earn less than $100 a month in wages. Looking back at how we financed our mission and operations to date, we're now at a network size of 15 locations in 4 counties in Nairobi. And this has largely been, kind of going through the typical stages of growth from our early stages, pre-seed, seed, and now entering our growth stage. We've utilized a blended financing model, so a combination of equity, for a combination of both commercial and impact investments. And this is really towards driving growth, long-term sustainability, and because we do envision exit opportunities with the model at scale. We've also deployed or utilized philanthropic capital and grants. And grants are deployed specifically towards public health programs and interventions that we recognize in order for us to provide a comprehensive care offering. There are long-term care needs, for example, for people with diabetes and hypertension, maternal child health, that the cost of this long-term care in kind of global standard of care might remain out of reach for low-income people for at least a foreseeable future, without alternative ways to provide these services and finance them. And so we're raising a blended financing round now to accelerate our growth. It's about 40% in equity, 36% in debt, 12% in grants, and specifically 12% in outcomes-based financing. And so I'll share a quick overview, if that's okay, Judd, now on what this looks like, and I'll talk in more detail about how this is structured. Let's put up my laser here. So, this is Access Afya. We're a franchisor, and we're distributing care through our franchise clinics. Here at the bottom, these are local healthcare workers all over that are replicating the business model and the impact, and they're serving low-income communities. So typically we have our financing, coming here in this blended structure that I mentioned of debt, equity, and grants. In our kind of proposed ratios, we receive, it's a commercial franchise model, so we receive fees from the franchisees in return for the back-end support that we provide the franchises. And we oversee the franchise's performance in terms of the quality and business performance, and have continuous feedback loops driving both business and impact metrics. And so over here on the right side of the screen, more specifically, is how the outcomes payments are structured. And so we're working with Impact-Linked Finance Fund as our outcome payer here, that compensates Access Afya for low-income customers. So in the design phase of this, we look at, where are these tensions that might exist as we think about growing our model. They might exist in deprioritization of certain services. They might exist in a decline in quality as where we continue to grow. And these are some of the metrics that we established as metrics for the outcome payments. And so we extend these as the franchisor and basically align incentives with the franchisees to achieve these goals. So in kind of unison, the franchisor, the franchisee are aligned on these impact goals. And then we have impact-linked finance here then on kind of a term basis that we've kind of set out, provide the compensation to the franchisor, Access Afya, as we deploy this over the next 3 years. And then on the far right here, we have an independent verifier that basically looks at information across all its sources and does the verification for these impact metrics on the timeline that we've established. So this in summary is what at least our outcomes-based financing structure looks like, and definitely sitting alongside there the other types of capital that we're deploying.
Great. Thank you, Daphne, for that explanation. And so have I guess sort of what are the advantages and disadvantages as you see it for leveraging that sync model?
So I think the most kind of state the obvious one is mission alignment. So this outcome-based financing allows us to stay true to our mission. So for each kind of percentage over or creating access to some of these global health conditions, which is specifically the targets that we created that made sense for us, Access Afya receives a payment for achieving those goals. And so this allows us to maintain our mission of, like I mentioned at the beginning, is to provide comprehensive primary health care. And so while there's risk of deprioritizing these services for more profitable services or that require less inputs to be able to deliver them, we can remain kind of really mission focused and provide comprehensive care of something that could otherwise be left behind as we continue to grow with either Access Afya or our franchisees not prioritizing it as much. And so it ensures that we have this continuity, and you can see the alignment with our mission there. I guess the second one, just a quick second advantage there is the results based focus. So it encourages results oriented approach, and so this is motivating for both Access Afya as a franchisor and a franchisee to deliver on those metrics, and similarly in increasing we'll have that can kind of continue to collaborate and build on some of this traction. So in terms of some disadvantages, that kind of come to mind here is it is complex measurement and reporting, and so it requires investing in data collection, analysis, and tools. So for Access Afya, fortunately, we've been tech-enabled. That's the premise of our whole model, kind of from day one, and so information is available. We're already measuring our impact, but if an organization isn't already collecting the data, then there might be some lift here to be able to need to invest in the data collection, analysis, and tools, and your team to be able to structure something that is quite meaningful. So one key mitigation that I would mention there for the people on the call is the careful alignment of your metrics with what you routinely collect and report, so you don't have this additional, kind of scope of resources work that you need to put in. So I'll pause there and maybe also just get see if there's any other input from anybody else. I think there's from the funding side and other panelists on the call. I think there's probably a lot more in terms of what has been seen as some of these models have been deployed.
Great, thank you, Daphne. Yeah, let's turn it over to the other panel members. I'd like to get your perspectives on the financing structure described by Daphne. What are some other financing models that you looked to in structuring the deals, and under what conditions would they more likely be implemented?
I can start, sure. Yeah, I mean, so, for us as a UBS Optimus Foundation, we have been a sort of leader in the field of outcomes-based financing since the early days. We supported the first education impact bond in the world, and we were excited to build on that success, and also partnering to launch the first health impact bond in the world, which was the Utkrist Maternal and Newborn Health Impact Bond in Rajasthan, India. But why do we want to use these kinds of instruments in the first place? I think first and foremost, we see outcomes-based financing as an important instrument for driving more and better results, and to a way to spend differently to achieve more impact by shifting from the typical emphasis on inputs and activities to outcomes, and making payment contingent upon achievement of those outcomes. This also gives us the opportunity to create more inroads for leveraging private capital to help us achieve the SDGs. So we know that there's an estimated 2.5 trillion annual financing gap to reach the SDGs, which is actually conservative. And so, we really think that these types of instruments hold a lot of potential to kind of grow the pie of capital that we can leverage to achieve the SDGs. And just for kind of level setting, so a development impact bond is an outcomes contract where investors are providing the upfront capital that an organization is using to provide a service or implement a program, and then that capital is paid back by outcome funders only if the outcomes that are predetermined have been achieved and verified. But we've seen a really strong kind of evidence of results in the development impact bonds that we've participated in to date. So, for example, Educate Girls, which was this first education development impact bond in the world, which focused on getting girls back in school and achieving better learning outcomes, achieved 160% of the program's learning targets. And Utkrist, which I mentioned earlier, which focused on improving the quality of care in small private maternity hospitals in India, improved standards in 13% more clinics than targeted. And in the quality education DIB, which is the largest education DIB to date in the world, also focused on improving learning results, showed really strong learning results way ahead of control groups and ahead of the service providers that were involved, their previous grant-funded programs. So we feel like these DIBs have really shown that this way of working stimulates service providers to work smarter, to be more flexible and innovative, to be more results focused, and to achieve better results. And they've also shown that they work well even in times of stress. So despite the COVID-19 pandemic and the disruptions that caused with school and clinic closures, the Utrecht and the quality education DIB all finished on time and on target. So again, as I mentioned, we think outcomes-based funding mechanisms like development impact bonds and like what Daphne was mentioning have really strong potential to help kind of grow this pie of private capital to help achieve the SDGs. And we're really working towards right now scaling the impact bond market through a blended finance investment fund that's investing in a portfolio of development impact bonds. But as we've already heard from Daphne, DIBs are not the only mechanism through which a social investor or an enterprise can engage in outcomes-based financing. They're just one tool in the toolbox. We also use outcomes-based funding when we provide debt to social enterprises, what we call impact loans, which is where we have an interest rate of the loan that is tied to clear impact metrics and targets that are defined upfront. And when impact targets are achieved or overachieved, the interest rate goes down, sometimes even to zero. And when the targets are underachieved, the interest rate goes up to a set maximum, which is usually around 7%, so still below market rates. So that's another example of a way that outcomes-based financing can be used to help social enterprises like Access Afya to grow and scale, while also incentivizing them to remain focused on their mission. Maybe I'll turn it over to Nicole now to give us some perspective on how outcomes-based financing is being used to drive better results within multilateral and government funding.
Thank you, Marissa. Yeah, I think you both captured actually the range of different instruments quite well, right? And over the last years, a lot of different terminologies have emerged for these instruments. So I hope this is not very confusing for people. Often there are like different names for the same instruments, but I think ultimately what matters is like the principle behind it, that there's some funding that is linked to the achievement of impact indicators and targets, right? And the rest really depends on your own operational model. Like, are you pursuing like a program that is somewhat bankable, right? Are you in need of greater like upfront working capital actually to implement your activities to get the results, in which case the development impact bond that Marissa was describing is really, really useful, right? Because you need to first have that capital to actually get to the results before an outcome payer can come in and pay for the results that you have achieved. Another term that has emerged or like another instrument are outcomes funds, but they work very, very similar to impact bonds, and only have that feature that actually different outcome payers come together to pool their funding in order to then pay for the results achieved. And this is something where that we structured with, for example, Living Goods in Uganda. Living Goods is managing a network of community health workers who are delivering really essential services to rural communities. And they have experimented with this quite a bit as well. And we have seen over time like how those mechanisms also evolve. To give you a sense, initially it focused much more on like the quantity of the results, and in the second iteration of the program we integrated a much stronger focus on how do we measure quality of services provided, which I think is a really important area that currently many practitioners and others are thinking about. How do you measure quality of service delivery? But yeah, a little bit like to Marissa, your question. So over the last maybe decade or more even, we have seen all of those instruments emerge, and we have been piloting and testing. We have seen how to structure those instruments or financing mechanisms in a way that they can provide greater impact. We have learned a lot about how to reduce the transaction costs as well, the space overall. And Instiglio is now working much more to think about how can we support the scaling of those models? So how can we integrate them into large-scale funding opportunities, like funding streams from buy and multilateral organizations such as the Global Fund, to governments as well, adopting those mechanisms in order when they are contracting out services, for example, to hold implementers accountable for results, but also to introduce greater flexibility in the way the activities are being delivered. So right now, for example, we are working with the Global Fund and many in-country stakeholders in more than 10 countries to help their grant agents, principal recipients, to shift to those models, really replacing that strong focus on inputs and receipts, which can often favor organizations that have very strong compliance and financial management systems in terms of like who gets contracted, to switching to results-based contracts or outcomes-based financing, that ultimately provide a much stronger focus on selecting those organizations that have a strong track record and high capabilities of actually delivering the results. And that's a little bit due to your questions as well, like what are good conditions to using those mechanisms. I think we talked about the need to really identify performance indicators that are measurable, that are closely aligned to impact, and that are under the control of the implementer as well, right? Other conditions are that you do have some data, ideally on what is your performance track record, what are your costs of delivering services, so you can price essentially those results accurately, and you can set accurate performance targets. And then the last condition I would mention here, particularly from like the entrepreneurs, is like the more you have strong performance management systems already in place where you're gathering data to assess whether you're on track to achieving results, which enables you to course correct and, you know, like achieve more results, that would be another condition that I would mention.
So much, Nicole, that for a great overview and some of the challenges. I'd like to turn it over to other members of the panel. Any other sort of challenges to putting together blended finance and other outcomes-based financing models? What's preventing this type of financing structure from scaling and reaching more ventures to achieve their social goals?
I mean, I think there's been a lot of criticism kind of levied at outcomes-based financing mechanisms as being too complex and costly to structure. And I think there are a couple of things that are kind of driving that. You know, one is, as you kind of alluded to, Judd, this issue of scale. So I think many of the outcomes-based financing mechanisms to date have been treated as pilots and implemented at a relatively small scale. And as a result, yeah, if you look at the sort of, you know, costs of structuring relative to the amount of outcomes funding, it is going to be, you know, kind of little bit out of whack. The other piece, I think, is that, again, because they've been more pilot type approaches, there have been a lot of let's say kind of bells and whistles included that you wouldn't necessarily need in the future. So for example, you know, evaluations have been included in the costs that you wouldn't necessarily need on an ongoing basis. In addition, I would say, you know, it's something where having experience helps. So having that kind of learning and knowledge of how these mechanisms work really helps, and everyone gets better as we go along. So that's something that I think, as we continue to learn and grow, it will get easier. I think also there's been a bit of mistrust among the different kind of players, and a lot of the cost and length of time to design has come from mistrust among outcome funders. And so again, I think this is just something that can be solved by continuing to do more and increasing that that kind of experience and trust. I mean, that's sort of on the kind of scale side. And then I think another issue that we see that's impeded the growth is actually a lack of outcome funders. This is really kind of the rate limiting factor right now. We definitely think that scale will come from widespread government adoption of outcomes-based funding, like what Instiglio is working on. But as always, philanthropy has a really important role to play in demonstrating to governments how innovative approaches like this can be adopted. So I think, you know, we're really strong advocates of getting more outcomes funders to come into this space and to really see the value of working in this way.
Hey, Marissa, that's great. I mean, Nicole, Daphne, any other thoughts on challenges?
If I could just chime in as well. I think Marissa has put that very eloquently. You know, it is kind of early stage. We need to see a lot of the results are kind of, you know, there's a lot of building and iterating on these deployments. But I think, you know, it's definitely agreeable that there is, you know, this huge potential and space and social enterprises that require this type of financing. And so just one, you know, kind of additional mention here on, you know, kind of potential challenges, and at least in this example as well, Access Afya's example and how it's been mitigated. You know, it does also, for the social entrepreneurs, social businesses, require a degree of risk tolerance. So this can be, you know, introduced as your payments are tied to outcomes, right? And depending on the financing structure and your cash flows of your business, and these payments coming out in a kind of a scheduled timeline, and dependent on these assessments that are outcome based, an organization needs to be in a position to be able to take that risk, right? And so in the ratios of your blended financing structure, you know, whatever makes sense for the organization, some of the ways that it's you know, kind of dealt with in the scenario that we're using here at Access Afya is the you know, kind of additional capital to raise alongside you know, this social impact incentive, and so it kind of limits the risk of you know, kind of having 100% or a good proportion of your you know, kind of financing coming from this particular structure, where the outcomes sometimes can even be beyond you know, the business's control, and that kind of brings me to my last point in terms of like where we also need to look is, as we're recognizing these circumstances, how are we building flexibility into these contracts to be able to establish this, you know, or deal with this outcome uncertainty and limited flexibility that it can introduce.
Thank you.
Yeah.
Go ahead, Nicole, please.
Yeah, maybe just to complement, or rather also suggest like a different perspective, right? Like I think Marissa is absolutely right. I think the biggest criticism is that the transaction costs are really high, where it's very time consuming for stakeholders, right? But a lot of this comes from the fact that now you need to rigorously ask, like, what are the results that we actually want to achieve? How do we measure them? How do we set appropriate targets? And what does it cost to achieve those results, right? And arguably, that are the questions that we should ask us, like this space, right? And that we should get more clarity and certainty on, independent of kind of what financing model is actually being used, right? So it's this natural shift from like that the space has focused so much on like accounting for how money is spent, right? Instead of what value is created, and getting used to using new techniques to estimating like the results or projecting the results that you want to achieve, which I think adds value beyond just like one transaction, right? As much as it does for many of the organizations that operate under such outcomes-based financing. structures such as Educate Girls, for example, they really undergo sometimes a transformation, right? Because this challenges them to improve their impact, to achieve more, right? And that has impact beyond just like this one project, for example, that is being financed on an outcomes-based financing mechanism in terms of like how the organization operates. And then the other cost that those mechanisms entail is verification cost. So independently verifying what results have been achieved. But over the last years, we have seen like how new like technological solutions and that many of the I think entrepreneurs are actually bringing to the market in order to drive costs down, how those can be leveraged for independent verification, making those outcomes-based financing models much more scalable as well.
Thank you, Nicole. So, I mean, I think you guys have touched on a lot of the sort of various aspects that are, I guess, what's asked of the venture in putting together a structure like this. That, I mean, you need to have data systems in place for tracking outcomes, and you need to have a good sense as to what your cost drivers are and what it costs, what it costs to deliver care to the target audiences. So let's talk a little bit about, what are, I guess, how would an organization know they are a good candidate for outcomes-based financing, and how should one think about preparing for such financing?
I can jump in, Jay, with a couple of thoughts. I think, yeah, so number one is a kind of collaborative mindset. So you've heard, in a lot of the discussion today that there's a kind of different aspects to kind of come together. So the organization's impact, the funders kind of kind of needs in terms of being able to tie specific outcomes to the activities and the impact that's been created. And so, it's one is the willingness to collaborate, on that, the willingness and the time to be able to dedicate to that, because in the kind of execution, the definition of that, I think we can already see that there is kind of tremendous impact that can be achieved through this. And so just that approach, I think, is hugely beneficial to building these partnerships, and also sharing back the results that we've seen that can help inform the entire practice and space. And I think the other ones are more obvious in terms of the readiness. In your data collection systems, you're already tracking your impact in some way or the other. I think one particular kind of folly to avoid is doing something outside of what you would typically do. So you're already executing on your kind of social businesses. You're deciding, you're thinking about a kind of social impact that you're creating. Maybe you're measuring it as well, but really kind of doubling down on that and really aligning this well with your structure. So if it's there, kind of go for it. One helpful thing that was useful for Afya was thinking about it in this way is, what are the tensions of your business? What would you like to continue to do, but you can foresee that it's going to be more difficult to do because, on the kind of profitability side of the business, it introduces this kind of tension, and that's where you might want to think about, where and how to design your outcome-based financing, or your metrics, or your impact that you want to focus on.
Yeah, I mean, I think I would agree with everything Daphne said, and just to add a little bit, I mean, I think already having that kind of performance management, kind of orientation and systems in place, as Nicole also previously mentioned, I think is super important. I think having that also kind of adaptive management orientation as well. So I think, already having that view of we're collecting data and we're using data to inform how we to track our results and to adapt as needed if we're not on track to achieve our results. I think that's really key. And then I think, so that goes along with, I think, being flexible and adaptable, and not being too wed to sort of one approach or way of doing things, and willing to experiment and see what's working and not working. I think also a willingness to be transparent and open and share data, share successes and challenges. I mean, some of what we've seen in what it took to make some of these development impact bonds work in the context of COVID was really, as Daphne was saying, having that kind of collaborative mindset, but also really being, transparent and open and sharing challenges early on and being willing to kind of work through those in that kind of collaborative fashion and be able to kind of as a partnership, as a group, really be able to adjust as needed. I think that's, maybe Nicole has other things to add.
I think you covered them all really well. So yeah, just building on what you mentioned at the end, I think thinking about how you're building that performance culture within your organization as you're scaling as a business, because it's easy to have that at the initial stages, right? But as you're growing, how do you really make sure you scale and maintain that performance culture and that openness to change, that openness to learning, that openness for different teams within your organization to surface challenges and things that also went wrong, right? Maybe to add that.
Thank you all. I think we've covered sort of the basis of the various structures of impact financing and the challenges of implementation and what you need to think about when considering putting that in place for your venture. So I'd love to maybe turn it over to our other guests and participants as far as asking questions of the panel or sharing a story of their own. So I think we do have one. If you'll use the Q&A channel to submit those. Daphne, do you have access to that question there, or otherwise I can read that out to you from Juan Pablos.
I do not see
Okay,
it.
it might only be visible to the host. So I'll go ahead and thanks for sharing your views. I have a question for Daphne, or maybe a clarification. Since my previous understanding or awareness of about results-based finance was more related to SIBs or DIBs, I had the idea of a service being provided over a period of time. My understanding is that your venture isn't temporary. Could you please confirm what's your timeline or approach with regards to the business model in terms of transitioning from being results-based financing, ventured finance, to operating independently?
Good question. So yeah, so I think the way that I see it, in healthcare, we don't have these typical, kind of curves that you might see in like a typical venture funded businesses. You might have kind of longer periods of innovation and in what we call this kind of valley of death. And so this blended structure supports very, in a more patient kind of capital kind of perspective, venture growth, in the innovation and solving some of these problems. Some of the problems that will face as social enterprises might not even be directly related to the services and the products that you're providing, but be more systemic. And you find a lot of social enterprises find that you're solving some of those problems as well. There's a health financing problem. There is an awareness, health awareness problem as well. And so you often need to drive some of that change as well as kind of building your products and services, and delivering them to the mass market. So we definitely, approach this because this is a for-profit business. We definitely also see this as, kind of limited period in which we're deploying this kind of blended capital, building towards full sustainability. And then because of the nature, particularly of the Afya businesses, we'll always be looking at commercial, because this is a model built for scale. So we're looking at commercial type financing to grow the model and to be able to unlock that. And there's a little bit of innovation that needs to go into the type of commercial funding that can be used that makes sense for this kind of model. So I think there aren't, very clear paths, but I think there is a lot of opportunity, and we're really seeing a shift in terms of the types of how we're thinking about financing to be able to achieve scale. So, social businesses can grow to the scale that they're required to have that social impact and complement, kind of public sector services as well.
Great. Thank you, Daphne. We have another question from Aaron. Does Impact Link Financing Fund pay for a specific service that is not very profitable, or more generally for low-income customers that might be unable to access services based on cost?
So I think this depends a little bit on how you design your solution. So what the impact linked financing will do is pay Access Afya for the impact that has been created. So we've grown access to specific services that were at risk of being deprioritized, and we've grown that access by continuing our interventions and activities and training and support for those services, so that they can continue to be provided at our franchise locations. So the outcome payment will be based on the achievement on that overall access created in that case. And so Access Afya, if it doesn't go directly to specific patients as services, but in our deployment of how we're designing, to be able to achieve those goals, we could offer, and in our case, we do offer a partial subsidy to our patients to be able to create that access, because we recognize that there is a financial barrier that they face, for a diabetic patient to be able to do, the full scope of testing on their cardiac function, kidney function, etc., and that they will require some level of subsidy. And so we will deploy that, because that's where we see the most helpful use of the resources for the patients to be able to achieve, again, our mission alignment, which is comprehensive quality care.
Any other questions from the audience, or anybody want to share an experience that they've had? Looks like Kevin has asked a question from the Forum for Family Planning and Development in the Philippines. Do you have similar support orgs located in the Philippines? I'm not sure who that's directed to, but Marissa and Nicole, can you answer, I guess, who can Kevin look to in that geographic region?
That's a good question. Instiglio, for example, doesn't have an office in the Philippines, but we recently actually worked there with the Global Fund on a TB project introducing results-based financing. It depends a little bit on who he's looking for. If he's looking for funders who are interested in the regions, or someone who can provide advice on how to structure this. Marissa, I don't know if you have something to add.
Sorry.
The question's around support organizations located in the Philippines.
Yeah, I don't. Sorry, I'm getting a lot of feedback.
Okay, well, while Moshe's working on that, Kevin has another question. Do you have a tool to help us assess if our organization, if we can also venture towards sustainable impact outcome-based initiatives? For context, we are an advocacy organization, but with advocacy little wins in legislations and programs, and we want to sustain demand and supply in communities which government cannot fully support. I'm not sure if you got the clear question, but I guess an assessment tool for determining whether or not that these outcomes-based financing tools are a good match.
I can jump in here. I'm not familiar with any particular kind of assessment tool. Maybe Nicole and Marissa might know, but I think what I would say is kind of a guide, because it's so kind of new. I think that the kind of useful benchmarks that you might kind of self-assess on whether you kind of have this is just kind of simple things. Do you already have defined social impact goals that you have as an organization? I'm sure that you do, and how clearly are they defined, and are you already tracking this? Are you already have programs that are running initiatives with these measurable outcomes, because you essentially be building off of this, and so do you have teams in place that are already looking at this? I think I haven't seen criteria once some of those basic kind of functionalities on your readiness are available. I think the next step really is in designing these then with the outcome-based funders, and at least in our experience, there's been a lot of flexibility to really explore and dig in and what's there, and let's not pick this set of outcomes because of XYZ reasons, and it's a very collaborative approach. And so I think, so to just kind of those self-assessments on those points and on your readiness. In our evaluation phase, I am seeing the use of some of these kind of more robust tools, and I feel then as an organization we can then choose in a very kind of comprehensive in their approach, even beyond the outcomes, the impact and outcomes that we're impact metrics that we're looking at, and can choose to either adopt and grow from there as well, to take them on as an organization, because you also understand that some of these impact assessment tools can be very kind of rigorous, and you need to find within your level of organization, resources, capabilities, the scope that you're going to be able to deploy, measure, and put resources towards.
Great.
Yeah, and I was just going to say, and I think I see it in the chat a lot, and sorry, I was having some technical difficulties, but the Oxford Go Lab has a lot of great resources on their website in terms of outcomes-based financing, sort of 101, and sort of different tools to understand different outcomes-based financing instruments, and perspective for funders and implementers. So I think that's a great resource for people. And then I see Nicole put something in the chat as well.
Yes, thanks for highlighting that, Marissa. I look some great resources there. So I think we've run, well, let's see if we can get maybe I think we've addressed these questions as far as, so we have another question was sort of, do you believe that the reporting structure is particularly complicated or onerous compared to your other funding sources? I think we sort of, I don't know if there's anything to add there. Daphne? The question was, do you believe that the reporting structure is particularly complicated or onerous compared to other funding sources?
It can be, but I think I've already mentioned it.
Yeah.
I think about how to be intentional about aligning it with what you're already doing, just so that you can avoid. And some of these are kind of mitigated against in the design phase, and so kind of coming to the measurement. We're already clear on where the sources of data are, how they're being collected, who's collecting them. And that verification process is kind of can be, a lot of these things can be mitigated with proper planning, I think.
Awesome.
Yeah, I definitely agree with
think
that. And I think too, I would say, I mean, in some respects, I think the reporting is actually quite streamlined because it's really focused on results rather than, a novel about everything that was implemented and how much money was spent and all of that. It's really just about, were the results achieved? What was the magnitude of the results achieved? And then how does that correspond to the kind of pricing that we've predetermined? So I think it actually simplifies things quite a bit, although you do put in that work up front, as Daphne mentioned.
Yeah. Well, I think we'll leave it there. I think we're getting close to the top of the hour, so I just want to take this opportunity to thank our panelists for joining us today. I thought we had a great conversation. We learned about a lot of new tools for blended financing, including social impact incentives, the sinks, development impact bonds, impact loans, and as well as other blended financing instruments. We learned about the advantages and how it can sort of enable you to achieve your mission and align you to results and drive discipline that way. But and in fact that they work well and even in times of stress, but can require a little bit more upfront transaction costs, though we are getting better at that system, and it can be challenged to find the outcome funders. Again, I think a great discussion. Thank you again, and I hope everyone has a great rest of their day. Take care, everyone.